hip, knee. How many more places are there, right? Well, after we get done this, I think there's TMJ, soft tissue stuff. There's some other odds and ends, but this is kind of like the last part of most of the extremities. So with the ankle and the foot, you want to remember we're always going to ask you your muscle tests and your ortho tests. So what muscles are there at the ankle? Well, obviously there's the tib anterior. So for that, you're going to bring the foot up like this, have the patient keep that position, and you try and pull it out nice and strong. For the peroneus muscles, you have them evert, hold that position, you try and pull it out nice and strong. You also have the big toe, so flex your toes up. I'm going to try and pull it down. Great. We also have toe walk and heel walk. If someone does toe walk, what muscle is that? Okay, what nerve root is that? Most people said S1, yeah. Some people were saying S2 before, and no, that's not right. Okay, heel walk. What muscle is that? Tib anterior, what nerve root? L4, great. Okay, so, and the peroneus muscle, or the big toe, what nerve root is that? Anybody know? It's L5. So you have L4, L5, and S1 that you can test with muscle tests. So remember those ones. Okay, so we're going to talk a little bit about testing the ligaments of the foot. So you can do these gross tests. You can do an anterior and posterior drawer, which is similar to the knee, right? So you can grip the ankle, grip proximal to the ankle joint, grip the heel, pull up. That's your anterior drawer. So you're checking those anterior ligaments to prevent anterior slide. By the same token, you can grip the ankle and push down. So anterior, posterior drawer, it's pretty similar to the knee. Unlike the knee, the foot can evert and invert, so you want to check those ligaments also. That's called the Taylor tilt test. So there's a medial and lateral tilt test. So if I check for lateral stability, that means I'm inverting. I'm stressing those lateral ligaments. So this is most common where you're going to get a sprain. An ankle sprain is going to be the lateral side because the medial side has the big deltoid ligament, remember? It's really uncommon that you're going to sprain this side. But the lateral side is very common. You have the ATFL, anterior tibiofibular ligament, and the calcaneofibular ligament. Those are commonly sprained. So the ATFL, PTFL. So what you're going to do is you're just going to grip the foot, and you're going to invert it like this and feel for any spongy end feel or pain. If somebody's had a sprain, you stress those ligaments, it's going to hurt. So you go this way, and then for the medial test, which obviously is less common, you're going to evert and check for pain or any spongy end feel. And hers pretty firm that way, and there's no pain elicited. So those are your Taylor tilt tests. So ortho tests for this area of the body, you have probably the most important one is the squeeze test. So this is for to check for a Morton's neuroma. So a Morton's neuroma is a nerve sheath cyst, essentially, that occurs most commonly either between the third and fourth or the fourth and fifth, mostly the third and fourth metatarsal heads. So the way you do that is you just grab the foot at the metatarsal heads and you squeeze it. And you're looking for pain. It's as simple as that. The other thing you can do is what's called Thompson's squeeze test. So if you flip over face down, this is to check to see if someone's ruptured their Achilles tendon. So typically, actually scoot back a little bit more. Okay. So typically, if I squeeze her calf, what's going to happen to her foot? It's going to plantar flex because it's almost like it's similar to tightening the Achilles tendon. So look, her foot moves when I do that. If you did this and their foot didn't move, it means their Achilles tendon is ruptured. So you're probably going to have a suspicion that something's very wrong. I feel like this is a little bit of a silly test, but it's there nonetheless. So Thompson's squeeze test. And then you have another test for a deep vein thrombosis, Homensign. You've all heard of Homensign, right? Mm-hmm. So it's similar to Braggart's in the sense that you are going to forcibly dorsiflex the foot and look for pain. So flip over again. So that's pretty much you're just going to take the foot and dorsiflex it and look for pain. So deep vein thrombosis.
So that's the whole position? She's sitting like that and you pull up the foot just like that? Or?
Typically you grab it like this. You can go like that. But yeah,
and they're not laying down?
Forcibly dorsiflex. Okay. It doesn't really matter for that one.
Okay. Maybe to Dr. Brown.
Okay, and so other things with the foot, you want to examine the arches, see if there's pes planus or pes cavus. All right, so now we're going to get into, we'll do a couple of adjustments, and then I want you all to practice. When you practice, I want you to do your muscle test, your ortho test, and these two adjustments I'm going to show you. So the first thing is if the tibia has gone anterior. Okay, so if the tibia has slid anterior relative to the talus, you want to slide it back posterior. So the way you're going to do that is you're going to grab you're going to grab proximal of the ankle joint. You're going to grab under the calcaneus, and instead of me thrusting the tibia posterior, I'm actually going to take the whole foot and move it anterior. So I'm going to fix this one hand and do essentially an anterior draw with a thrust. Okay, does that all make sense to everybody? It's pretty basic. So that's for to correct an anterior tibia. The next one is the tibiotalar joint. So this is a very, very common manipulation. I was just talking to Dr. Saman. We use this one all the time. So for this one, you're going to grab the foot. There's two ways to do this. You can either encircle your middle fingers right over where the talus meets the tibia, and then let the rest of the fingers fall. The hands come under the foot. You're going to traction back, and then you're going to thrust. I actually just got a release on her. So one thing to note is that when you do it, there is slight medial tilt to this. I'm pulling a little bit harder with my right hand than my left hand, but mostly, for you guys just starting out, it's mostly just a thrust straight back. So you're just distracting the joint, you're resetting the talus and the tibia. So I'll show you on the other side. The other way to do it is just to interlock your hands over it so your pinkies are kind of at that same spot. So then you're going to lean back. You always want to get all your traction, get to the end range of motion, and then.
So he's going internally rotating.
So that is the tibiotalar adjustment,
and
and you will use that very commonly if you do any physical medicine. So I want you to practice up the anterior tibia,